दिखाओ मेरे को।
Hello and good evening, everyone. Yes, please mute yourself. If you need to tell me something, then please use the chat box, okay? Yes. So how are you guys doing? I hope all of you guys are fine. Yes? Yes, so welcome to the first live session for the NEET MDS 2027 batch. Uh, like, I'm so happy and excited to be a part of your NEET MDS journey. And before starting the session, let me introduce myself. I am Dr. Nivedita Tampan, and I am your subject mentor for dental anatomy and dental histology. All right. Okay. So, like, the first step is always the hardest, and you had already taken the first step. Okay. You had already uh, enrolled for the NEET MDS journey, and that's a great achievement from your part. But that's not enough. I have seen like many students being like very excited and very enthusiastic and very energetic during the first few months of this NEET MDS journey. They'll be attending every live class and they'll be attending all mock tests. But as months pass by, I had seen them like losing their interest and being inconsistent. Okay, so please don't do that. Please be consistent in your journey till the end. Okay, and the whole Eden2 team is also with you, helping you for all your classes, for all your tests, and for everything. So, in case if you have any doubt or have any issues, please feel free to contact us also. Okay, yes. So, yes, we are like officially starting this NEET MDS 2027 preparation journey with a very simple and basic subject from first year, that is oral histology. It's a very easy to learn subject. It's easy to retain, and it is easy to understand the concepts of oral histology also. That's why we had chosen this subject as the first subject, and overall a very easy subject. If you are really careful while answering all the questions, all the MCQs related to oral histology, then definitely you can score full marks in oral histology. Okay, in all the questions that were asked from oral histology, you can score full marks. Okay, now let's have a look at the topics. Okay, at the weightage of the topics for dental anatomy and oral histology. Okay, so yes, dental anatomy, embryology, and oral histology carries an average. Okay, you can expect an average of 14 questions from dental anatomy, embryology, and oral histology for your NEET MDS examination. And out of these 14 questions, usually like 5 to 8 questions can be asked from oral histology, and something like 4 to 5 questions can be asked from dental anatomy. Okay, there can be change in the number also, but yes, this is the average number of questions you can ask, you can expect from both oral histology and dental anatomy. Okay, so this dental anatomy and dental histology, it is a basic subject. Okay, it is a fundamental subject. Okay, so it is extremely important to keep the fundamentals strong. Okay, get the fundamental concepts regarding this oral histology. It should be really strong. Okay, then only the higher and more advanced clinical subjects or subjects like oral medicine and oral pathology, all those subjects will be much easier for you. Okay, especially if you look at it, the developmental disturbances and the salivary glands, bone chapters, and all those things. If the basics in oral histology is like thorough in your mind, then these pathologies are really simple. Okay, because if you understand what is normal only, then the abnormal becomes much more easier for you, right, to understand also. Okay, so that's it. This is the basic one. So yes, medicine and pathology can be easier. And of course, you have overlapping topics of this oral histology with other subjects also, like general histology and embryology. The development of face, development of the orofacial structures are included in that also. And some of the advanced clinical subjects like perio, pedo, and ortho has also like overlapping topics with oral histology. In perio, the all the basic first unit chapters like the gingiva and tooth supporting structures, the alveolar bone, the cementum, periodontal ligament, all those basics come back to oral histology only. Okay, so when you study this, you will be covering that also. Okay, so that is like a major bulk of subjects getting covered together. Okay, and in ortho and pedo, the basic chapters like the development of the oral facial structures, development of mandible, development of bones, all those, the basic come back to this oral histology itself. Okay, so when there are overlapping topics between the subjects, try to learn them together. Okay, so that you will be able to cover a whole bulk of topics together. All right. Yes. Now, which books you should refer for dental histology? Okay, so oral histology, the main focus should be definitely on solving MCQs, because this NEET MDS exam is an MCQ based exam. Okay, so the main focus should be definitely on solving MCQs. But if you are not understanding the concepts properly, or for image based questions, you can definitely refer these two textbooks. The first and the most important one is 10K's oral histology. Okay, 10K's oral histology is so important that some of the image-based questions in the recent NEET MDS examinations were taken directly from this book. Okay, so you can imagine how important that book is, right? Some all the images in the textbooks, for all the solving all the image-based questions, you should definitely refer and standard, okay, a standard textbook of the same subject. And I will recommend definitely 10K's oral histology, because as I had already mentioned, some of the questions were a direct pick from this textbook. Okay, so 10K's is very important. And there is also it and Juice image bank also present there. So you can also log into the app and look at the image bank also for solving this image-based questions. Okay, then 10Ks is a little bit detailed book. Okay, it's very wide and detailed, and all the explanations and everything are given in detail. So if you don't have time to understand this concepts in detail, then you can go for like a small to the point, like short and concise book, that is the oral biology essentials of oral biology by Maji Jose also. Okay, so these are the two books that I will recommend for oral histology. Okay, then what are these sure short chapters and cold spot chapters? What are they? Okay, sure short chapters means if you have a look at any of the recent NEET MDS question paper, okay, any of the recent NEET MDS question paper, you will definitely see at least one question from these chapters. Okay, so those chapters are the sure short chapters. Okay, cold spot chapters means questions may or may not be asked from these chapters. Okay, so they are the cold spot chapters. So let's have a look at what are these sure short chapters. Sure short chapters include development and growth of teeth, enamel, dentine, cementum, salivary glands, and oral mucous membrane. Okay, take any recent question paper of NEET MDS and definitely you will see a minimum of one question from these chapters. Okay. So in today's session, we are mainly going to focus on this development and growth of teeth, enamel, and dentin. Okay, all are short chapters. So you can imagine like how important today's session is, right? Yes. Now let's have a look at the type of questions they can ask you for your NEET MDS examination from oral histology. Okay, so basically three types of questions can be asked. First is direct straightforward question. Okay, direct straightforward question means it will be questions like this. Okay, they are just given to test your memory mainly. Okay, so such type of questions are the factual type of questions or the direct straightforward type of questions. Okay, questions like this. Okay, around like 75 to 80 percentage of the questions that come in oral histology are direct questions like this only. Okay, then you will get image based questions also. Image based question means they can give an image like this and ask you to identify the marked structure or identify which structure is shown in the image like that. Okay, image based questions are also a favorite of examiners for NEET MDS examination from oral histology. Around like 20 to 15 percentage, 15 to 20 percentage of the questions can be such image based questions also. Okay, they can ask image based questions also. Then very rarely you can encounter clinical based questions. Okay, since oral histology is a basic science subject, they usually don't ask such clinical based or application based questions. But if they really want to make the exam tougher, then they can ask clinical based or application based questions even from basic science subjects like this. Okay, so usually such clinical based questions are not asked, but yes, you should know regarding them also. Okay, like a child suffers from febrile illness. During the illness, the tooth development temporarily slows down. The development resumes normally soon after. This change in development of tooth structure is most likely to be apparent in which of the following histological features of dentin. Okay, so such questions can also be asked. Okay, you must be prepared for such questions also. Okay, but majority of the questions from oral histology are usually either direct straightforward questions or image based questions only. Okay, right. Now in this session, first we will have a look at some of the important high yield topics from development of teeth and enamel and dentin, and then we will go on to discuss the multiple choice questions. Okay, so yes, starting from development of embryo. Okay, so development, like I had already told in many of the classes, development of teeth and development of face or development of oral cavity, all the development should study like a story. Okay, so that your retention will be better. Okay, so development of the embryo begins with the union of sperm and ovum, resulting in fertilization. Fertilization will result in the formation of a zygote. Zygote is a continuously dividing cell. Zygote is just one cell. It is a one cell structure. Zygote is a one cell structure. It is capable of continuous divisions. Okay. It will keep on dividing, and will form 2-cell stage. And again, it will form 4-cell stage. It will form 8-cell stage, and it will form 16-cell stage, and then morula. Okay. Once it reaches morula, it gets converted to blastocyst. And this blastocyst is the structure which goes and gets implanted inside the uterus. Okay, so once the implantation happens, implantation usually happens by the end of first week itself. So once the uh, zygote, it is after the blastocyst, when it reaches the uterus, it again divides, and it forms embryo. Okay, and this embryo will start now growing inside the uterus. Okay, so by around third week of embryonic life, okay, by around third week of embryonic life, two major things happen for the embryo. Okay, can anyone tell me what are the two major things that happen to an embryo in the third week of intrauterine life? Yes, you can put your answers in the chat box, doctors. Yes. What happens during the third week? Anyone? Okay. I don't see any response. Yes. Okay. So by third week of embryonic life, what happens is that two major changes happen in the embryo. Okay, so what are the two major changes that happen in the embryo? First one is gastrulation and second one is neurulation. Okay, so what do you mean by gastrulation? Gastrulation means it is the formation of germ layers. Okay, what are the three germ layers? A simple question. What are the three germ layers? Anyone? What are the three germ layers? Yes, you are right, Kartika. The three germ layers are ectoderm, endoderm, and mesoderm. Okay, so yes, you are right. Yes, doctors, you are right. Yes, so the three germ layers are ectoderm, endoderm, and mesoderm. Okay, so what happens is uh, when this the formation of these three germ layers, it is called as gastrulation. Okay, so another major thing that is happening in the 3-week-old embryo is the neurulation. Okay, so what do you mean by neurulation? Neurulation is the process of formation of neural tube. Okay, so neural tube is here, it shows the process of formation of the neural tube. Okay, there is a neural plate. This neural plate will fold inside and it will form the neural groove, and then it will close and form a hollow structure like this, which is the neural tube. Okay, now just before the formation of this neural tube, at the crust of this neural fold. Okay, so this is the crust of this neural fold. From the crust of this neural fold, some special cells are there. Okay, such special cells are called as the neuroectodermal cells. Okay, so these cells, what they do, they will migrate to the connective tissue in the head and neck region. Okay, connective tissue is a term that we use for a mature type of connective tissue. Okay, but in the development process, during the development process, we don't call it connective tissue, we call it mesenchyme. Okay, mesenchyme is the primitive form of connective tissue. Okay, so to this connective tissue, these cells will get migrated, and once the cells get migrated into this connective tissue, now they are called as ectomesenchyme. Okay, now that particular connective tissue is called as ectomesenchyme. Okay, so this migration of neural crust cells is very, very important, because when these neural crust cells, they migrate, only the development happens. Okay, the development of tooth and the peripheral nervous system and the pigmented cells like melanocytes, all these are getting formed from these neural crust cells only. Okay, so when their migration happens, these all structures start getting formed. Okay, so the neural crust cells are, some of the researchers, they even call these neural crust cells as the fourth germ layer. Okay, why the fourth germ layer? Because so many structures are getting formed just from this neural crust cells, so they are calling it as a fourth germ layer also. Okay, now by around fourth week of embryonic life, this embryo will have a cephalic end. Okay, this is the cephalic end, and at the bottom you will have the caudal end also. Okay, so at the cephalic end you will have the brain. Okay, future brain that is developing, and in between, and the cardiac bulge also. Cardiac bulge means that the future heart is getting developed. Okay, so in between this future brain and future heart, you will have a small opening like this, that is called as the stomatodium. Okay, so this stomatodium, it is also called as the primitive oral cavity. Okay, so by around third week itself, you will be able to see the primitive oral cavity. And in the primitive oral cavity and the future foregut. Okay, that is the future alimentary canal. Okay, so this primitive oral cavity and the future alimentary canal will be separated by a membrane. Okay, that membrane is called, what is the name of the membrane? Anyone? The membrane which separates, yes, Dr. Kartika, yes, Dr. Ria, all of you are right. That membrane is called as the buccopharyngeal membrane. Okay, so this buccopharyngeal membrane, it breaks. Okay, around by fourth week, the buccopharyngeal membrane will be there, which separates the primitive oral cavity from the future foregut. By around 4 to 5 weeks, what happens is that this buccopharyngeal membrane will break. Okay, when it breaks, there will be a connection will be established between the future oral cavity and the future foregut. Okay, so once this buccopharyngeal membrane is broken, then the tooth formation starts officially. Okay, so in this, the primitive oral cavity, the stomatodium is lined by an epithelium and a connective tissue. The epithelium is called as the oral ectoderm, and the connective tissue, like I had mentioned before, it is called as ectomesenchyme. Okay, why ectomesenchyme? Mesenchyme, because it is a primitive type of connective tissue, and ectomesenchyme, because neural crust cells has migrated into this connective tissue. Okay, so that's why it's called as ectomesenchyme. Now what happens is, by around 7 week, like the 6th week or 7th week, what happens is that this basal cells of the oral ectoderm. Okay, so these are the basal cells of the oral ectoderm. They start proliferating. Okay, they start proliferating and will form thickenings like this in the ectomesenchyme. Okay, so it will form a horseshoe shaped thickening in the ectomesenchyme, which is called as the primary epithelial band. Okay, so this primary epithelial band will correspond to the future dental arches. Okay, it will be formed there in the maxilla and mandible, and they corresponds to the future dental arches. Now, in this primary epithelial band, at around 10 places, there will be small, small thickenings. Okay, again, lots of cell divisions are happening. So again, thickenings are happening. So that thickening is called as dental placode. Okay. Now this dental placode, from this dental placode and this primary epithelial band only, the most important structures are forming. That is the dental lamina and the vestibular lamina. Okay. Usually vestibular lamina will be at the buccal or the labial side, and the dental lamina will be usually seen in the inner or the lingual side. Okay. Now this dental lamina and vestibular lamina, this dental lamina will again undergo division at particular places and will form something called as enamel organs. Okay, so enamel organs are getting formed. So yes, this is a formed enamel organ. Okay, so you can see that this is the oral ectoderm. This overlying thing, that is the oral ectoderm. This is the dental lamina, and this structure is the enamel organ. Okay, now the area just below this enamel organ. Okay, this area that is just below this enamel organ, that is called as dental papilla. Okay, now the area that is surrounding both this dental enamel organ and dental papilla, that is called as dental follicle or dental sac. Okay, so we have the enamel organ. Then just below the enamel organ, we have the dental papilla, and the area that is surrounding this enamel organ and dental papilla, that is called as dental follicle or dental sac. Okay, so all these three structures together, that is enamel organ, together with dental follicle, together with dental papilla, it is called as tooth germ. Okay, so from this tooth germ only, all the structures like the enamel, dentin, and cementum, and the other two supporting structures are also getting formed from this tooth germ only. Okay, so let's see which all structures are getting formed. So in the tooth germ, you have the enamel organ, dental papilla, and dental follicle. So enamel organ helps in the formation of enamel with the help of amyloblast. Amyloblast are the enamel forming cells. Okay, amyloblast are the enamel forming cells. Then the dentine is formed from dental papilla with the help of odontoblast. Okay, odontoblast are the dentine forming cells. Then cementoblast are the cementum forming cells from the dental follicle. Okay, the dental follicle will also help in the formation of periodontal ligament with the help of fibroblast. The periodontal fibers are formed with the help of fibroblast, and bone also, alveolar bone also formed from osteoblast. Okay, you should know the name of each cell and which structure it is forming. Okay. Now, coming to the tooth development. Okay, tooth development, you can study it based upon two stages. One is morphological stages and the other one is histophysiological stages. Okay, so morphological stages, I think you'll be more familiar regarding the morphological stages. But in addition to morphological stages, you should also have a look at the histophysiological stages because sometimes the questions can be asked regarding that also. Okay, so morphological stages are mainly described based on the shape of the enamel organ. Okay, so what determines the morphological stages? The shape of the enamel organ that determines the morphological stages. Okay, so based upon the shape of the enamel organ, the morphological stages of tooth development has been divided into three. We have the bud stage where the enamel organ looks like a bud, and we have the cap stage where the enamel organ looks like a cap, and the bell stage. Okay, where the enamel organ looks like a bell. Okay, so these are the three stages of tooth development. Okay, then coming to the histophysiological stages, it's related. Okay, I'll show you how these morphological stages and histophysiological stages are related. But yes, the histophysiological stages are 5. Okay, you have initiation, proliferation, histodifferentiation, morphodifferentiation, and apposition. Okay, we'll discuss in detail what all these stages are. But yes, the formation of dental lamina is related to the initiation stage. Okay, and the bud stage and cap stage, they are related to the proliferation stage. Okay, early bell stage related to histodifferentiation. Advanced bell stage only we'll be able to see morphodifferentiation. Okay, and the enamel and dentine matrix. Okay, that is the hard tissue formation is mainly happening in the apposition stage. Okay, so this is how the morphological stages and the histophysiological stages are related. Okay, yes. So first, let's have a look at the morphological stages. Bud shape, like I had already told, this is the oral ectoderm. Okay, that is the lining of the primitive oral cavity. That is the oral ectoderm. Okay, and this is the dental lamina. This region, yes, that is the dental lamina. And this is the enamel organ. Okay, which is in the form of a bud. Okay, and just below the enamel organ, we have the dental papilla, and surrounding it, you have the dental sac. Okay, now it was bud shape, but then the cells will divide only at particular area and will form the shape of a cap. Okay, this cap stage is really important. So many questions have been asked from this cap stage. In the cap stage, what really happens is that the cells in the center of the enamel organ, they were polygonal in shape. Okay, but these polygonal cells, what they do is they release lots of glycosaminoglycans. Okay, they release lots of glycosaminoglycans in the bud stage. Okay, so what happens is that these glycosaminoglycans are hydrophilic in nature. That is, they are water loving in nature. Okay, since they are water loving in nature, what happens is that they will absorb all the water from the outside dental follicle to inside. Okay, so since these glycosaminoglycans are released from the cells in the center of this enamel organ, what happens is that all the water from the outside, they will be released, they will be like attracted towards the center of the enamel organ. So when this water will go and stay between the cells, okay, they will stay between the cells like this. Okay, these are all water molecules. Okay, they will go and stay between these cells, but the cell to cell attachment is still maintained. Okay, the cell to cell attachment is still maintained, but because of these water molecules, these cells are like completely stretched. Okay, so these cells will take the shape of a star. Okay, so that's why it is called as stellate reticulum. Okay, reticulum means a network and stellate means star shape. Okay, so this star shaped cells, they are called as this stellate reticulum. Okay, so this stellate reticulum is very important because they acts like a shock absorber. Okay, so all these defensive mechanism or the protective mechanism by the body are mainly to protect these cells. These cells that are seen in the concavity of the cap stage, yes, they are the inner enamel epithelial cells. Okay, so these cells, they are the inner enamel epithelial cells, and these cells that are seen in the convexity. Okay, this is the convexity. So these cells that are seen in the convexity, they are called as the outer enamel epithelial cells. Okay, so our body will at any cost protect these inner enamel epithelial cells. Okay, why do we need to protect these inner enamel epithelial cells? Because they are the future amyloblast. Okay, so they are the future enamel forming cells. Okay, so that's why our body is very particular in protecting these inner enamel epithelial cells. Okay, now there are something like the transient structures of the cap stage. Okay, this is extremely important because a question has been asked from these transient structures even in the recent NEET MDS 2025 examination. Okay, so extremely important. Transient structures means they are temporary structures. Okay, temporary structures means they'll be seen for a while in the cap stage, and when it progresses to the bell stage, it will disappear. Okay, so such structures that are seen in the cap stage, they are called as the transient structures. And which are the transient structures that are seen in the cap stage? Yes, there are 4 transient structures that are usually seen in the cap stage. One is enamel node, then we have enamel cord, then we have enamel septum, and enamel navel. Okay, enamel node, enamel cord, enamel septum, and enamel navel. Okay, these 4 are the transient structures, and you should not confuse between these terms. Okay, start with the node. Okay, enamel node is the first formed structure among these transient structures. Okay, so what is this enamel node? So this is the cap stage. So in the cap stage, the cells in the center of this cap stage or towards the down here, okay, they starts proliferating and will form a knot-like structure, just like we make a thread knot, right? Just like that, a knot-like structure will be formed towards the center and towards the like a below end of this cap stage. Okay, so that structure is called as enamel knot. Okay, why the knot-like structure is getting formed there? Because the cells are like continuously proliferating there. Okay, so lots of cells are getting proliferated, and it will form a very thickened knot-like structure. Okay, now some cells after the proliferation, what they do is that they will form a vertical extension like this. Okay, so this is the vertical extension that is formed from this enamel knot, and that vertical extension is called as the enamel cord. Okay, just like a cord. Okay, it is called as the enamel cord. Now, if this cord goes and reaches the outer enamel epithelium, okay, so this is the outer enamel epithelium. So this cord, it goes and reaches the outer enamel epithelium. Okay, now when it reaches the epithelium, what happens? You can see this enamel organ is getting divided into 2 parts. Okay, this is one part and this is the second part. Okay, so this cord, when it goes and touches the outer enamel epithelium, it seems like the enamel organ is separated into 2 parts. Okay, so that particular structure is called as enamel septum. Okay, septum is like any structure which separates the whole structure into two parts. Okay, so that is called as enamel septum. Okay, now the point where this septum touches the outer enamel epithelium, it will form a depression here. Okay, it will form a small depression here. That depression is called as enamel navel. Okay, four structures, extremely important. Start from enamel node. Enamel node is the like the cells in the center of the enamel organ which are densely packed and will form a knot-like structure. Then a vertical extension of enamel node, that is called as enamel cord. When this enamel cord goes and touches the outer enamel epithelium, that is called as enamel septum. And at the point where the enamel septum touches the outer enamel epithelium, that is called as enamel navel. Okay, because it looks like a navel. Okay, so that's why it's called as enamel navel. Okay, so these are the four transient structures. Okay, so this enamel node is extremely important because it is the particular area which controls the growth of the tooth, and this area also determines the shape of the cusp. Okay, so it is mainly like an architecture of the cusp. Okay, so this enamel node is extremely important, and it also acts as like a signaling center for the tooth morphogenesis. It releases lots of signaling molecules. Okay. Then coming to early bell stage. In the bell stage is the stage where we'll be able to see all the four layers in the enamel organ. Okay, so we'll be able to see the outer enamel epithelium. This is the outer enamel epithelium. Then this is the stellate reticulum. And just below the stellate reticulum and above the inner enamel epithelium, you will be able to see a layer of squamous cells which are called as the stratum intermedium. Okay, so the stratum intermedium is again another important structure. Why? Because it helps in the protein synthesis, it helps in the transport of nutrients, it regulates the enamel formation, and it also has high alkaline phosphatase activity. Okay, remember, if in our body any hard tissue is getting formed, let it be bone or enamel or dentin or cementum or any hard tissue is forming, there will be an alkaline phosphatase activity will be present. Okay, so this stratum intermedium is the one contributing to this high alkaline phosphatase activity during this tooth formation. Okay, then we have the inner enamel epithelial cells. Okay, so this inner enamel epithelial cells only become the future ameloblast. Okay, so from the bell stage itself, the all the deposition mainly starts happening. Okay, so tell me, which is the first structure that is getting formed in the tooth formation? Okay, tell me. Yes, doctor, which is the first structure that is formed from, yes, during tooth formation? Yes, Dr. Kartiga. Yes, any others? Is it dentin or enamel is the outer layer, right? So don't you think enamel is the first structure that is getting formed? Yes, Dr. Ayush. Yes, any others? Is dentin the first formed structure or enamel? Since enamel is the outer layer and dentin is only the second layer, so don't you think like enamel is the first structure that is getting formed? Any others? Any answers? Yes, so this is a common mistake that students usually make. They will think like, okay, the enamel is the most like the enamel is present in the outer layer. So definitely enamel is the first formed structure during tooth development. But no, enamel is not the first formed structure during tooth development. It is dentin. Okay, dentin is getting formed first. Okay, then only enamel is getting formed. Okay, so this is a like a very common mistake that students make, but please don't make this mistake again. Okay, because make it like to the mind. Okay, take it to the mind that it is only the dentin that is getting formed first. Okay. So how the tooth formation is happening. Okay. So these inner enamel epithelial cells. Okay. These cells that are like tall columnar in nature. Yes, those are the inner enamel epithelial cells. These inner enamel epithelial cells, what it does is that it will send signals to this dental papilla. Okay. It will send signals to this dental papilla. When it sends signals to this dental papilla, these peripheral cells that are present in the dental papilla, they will get differentiated. Okay. Differentiated means they will get more mature and they will start acting for a particular function. Okay. So that's called as differentiation. Okay. For example, uh, they become more specialized. Okay. Now we are just dentists. Okay. When you complete your MDS, you become like a radiologist, pathologist, surgeon, like that. You are getting specialized. Okay. Like that. The cells, they also get specialized. Okay. So here they are just undifferentiated cells. But when these cells, they get signals from the inner enamel epithelial cells, they become specialized. They become specialized and they get converted to odontoblast. Okay, the odontoblasts are the dentine forming cells. Okay, so they get converted to odontoblast. Okay. Now, just before the enamel formation or just before the dentine formation, this membrane that separates this inner enamel epithelial cells from the dental papilla, that membrane is called as the membrana preformativa. Okay, it is called as membrana preformativa. Okay, that is where the future dentino-enamel junction will form. Okay, so this membrane that separates the inner enamel epithelial cells from the dental papilla, that is called as the membrana preformativa, and that place is the one where the future dentino-enamel junction forms. Okay, now this is the outer enamel epithelium and this is the inner enamel epithelium. Okay, so this place where this outer enamel epithelium and the inner enamel epithelium meets, it forms a special loop-like structure. Okay, so that special loop-like structure that is formed at the junction of this outer enamel epithelium and inner enamel epithelium, that is called as cervical loop. Okay, so the cervical loop only is what is forming the future cemento-enamel junction. Okay, so the cervical loop forms the future cemento-enamel junction, and this membrana preformativa, it forms the future dentino-enamel junction. Okay, please do not get confused regarding the two. Okay, now we are going to the advanced bell stage. Okay, in advanced bell stage, mainly two things happen. One is mineralization and the other one is root formation. Okay, so let's see how this mineralization is happening. So like I had already told you, inner enamel epithelial cells, they will send signals to the underlying dental papilla. This dental papilla, they will take the signals and some of the cells, okay, this dental papilla, when it gets activated, some of the cells in the periphery of the dental papilla, they will ask these peripheral cells to get specialized and become odontoblast. Okay, so once they become odontoblast, what they do, what is the function of the odontoblast? They secrete dentine. Okay, so the dentine matrix is secreted first. Okay, so yes, it secretes dentine. Okay, now once the dentine is secreted, that becomes a signal for the inner enamel epithelial cells. Okay, so once the dentine is deposited, what happens is that the inner enamel epithelial cells, they are long columnar cells like this. They will become like really long columnar cells, and usually the nucleus will be present at the center of each cell. Okay, but when these inner enamel epithelial cells, when they get signal, they will get converted to amyloblast. Okay, so amyloblast, what happens is that this nucleus will go towards the away from the basement membrane. Okay, so this is the basement membrane and this is the normal inner enamel epithelial cell. Okay, this is the normal inner enamel epithelial cell and this is the amyloblast. Amyloblast, as you can see, the nucleus is away from the basement membrane. Okay, so this property where the nucleus goes away from the basement membrane, that is called as reversal of polarity. Okay, it is called as reversal of polarity. Okay, so once they become amyloblast, what happens is that what is the function of the amyloblast? They also become specialized. So what is the function of the amyloblast? The function of the amyloblast is to secrete enamel. Okay, so they'll start secreting lots of enamel. Okay, so one thing you have to remember here is that these enamel and dentine are all hard tissues that are getting formed. Okay, so till this stage, these inner enamel epithelial cells that are the future amyloblast, they are getting nutrition from this dental papilla. Okay, so because this dental papillae has lots of blood vessels. Okay, so they are getting nutrition from this dental papilla. Okay, but once this hard tissue, like the dentine, is getting deposited, what happens is that this dentine is getting deposited here. Okay, between the inner enamel epithelial cells and the blood vessels. That's where the dentine is getting deposited. So since it's a hard tissue, okay, these blood vessels, they cannot penetrate a hard tissue and go and give nutrition to the inner enamel epithelial cells. No, they cannot do that. Okay, so what they does is that how will these cells get nutrition? How will this inner enamel epithelial cells get nutrition? Once the hard tissue starts getting formed. Yes. Any idea, anyone? How do these inner enamel epithelial cells get nutrition once the hard tissue gets formed? Yes, Dr. Kartika. Any others? Any other opinion? Till now, this inner enamel epithelial cells are getting nutrition from the dental papilla. But once the hard tissue is getting formed, it's a hard tissue. So like I had told, it cannot go, these blood vessels cannot go and penetrate this hard tissue and give nutrition to the inner enamel epithelial cells because it is hard tissue. Okay. So how will you get the nutrition? Yes, Dr. Kartika, you are right. It will get nutrition from the dental sac only. That is the surrounding dental follicle only. Okay, so what is the mechanism that is happening there? Okay, so what happens there is that since now the inner enamel epithelial cells will not get nutrition from this dental papilla, what it does is that it will try to get nutrition from the nearest blood vessel. Okay, that is present in the dental follicle. Okay, but these dental follicle blood vessels are a little bit distance. Okay, they are at a little bit distance from that of the these blood vessels are at a distance from the inner enamel epithelial cells. Okay, so how can they get nutrition? What happens is that these stellate reticulum cells, they will collapse. Okay, they will just collapse and the distance between this dental sac and the inner enamel epithelial cells are reduced. Okay, so once the stellate reticulum collapse, what happens? These blood vessels will come in this here and the distance between this blood vessels and the inner enamel epithelials will be very less. Okay, so it is easy to give nutrition to them. Okay, so this happens by around the end stage of early bell stage or in the advanced bell stage. Okay, so this whole process is called reversal of nutrition. Okay, we had seen the reversal of polarity. Now the next reversal that is happening here is the reversal of nutrition. Okay, till now they were getting nutrition from the dental papilla blood vessels, but now the hard tissue is formed, no blood vessels. So what happens? They are getting nutrition from the dental follicle or dental sac. That is called as reversal of nutrition. Okay. Now, one other thing that I want to mention here is that you had seen how this odontoblast and amyloblast are getting activated and getting specialized. Okay. They are like helping each other. Okay. First, the inner enamel epithelial cells will send signals to the dental papilla cells. Odontoblasts are getting differentiated. Dentine is formed. the first formed dentine is the main signal for inner enamel epithelial cells to make enamel. Okay, so it's like they are interdependent on each other. Okay, so that is called as reciprocal induction. Okay, uh, it's like the amyloblast and the odontoblast and this enamel and dentine formation are like closely related and interdependent on each other. One is inducing the formation of the other structure. Okay, that is called as reciprocal induction, and such type of reciprocal induction is not much seen in any other part of the body. Okay, so three terms you have to remember: reversal of polarity, reversal of nutrition, and reciprocal induction. Okay, so this is the summary of all the developmental stages. You can go through like what are all the layers present in which all stages, and what are all the cells that are present in each stage, and what are all the events that are happening in each stage. Okay, so this is all about the morphological stages of tooth development. Now coming to the physiological or the histophysiological stages of tooth development, which includes the first one, initiation. Okay, initiation means that is the stage where the dental lamina and the tooth buds are getting formed. Okay, so if any insult or if any thing is happening at this initiation stage itself, then it can result in anodontia or oligodontia, partial missing of teeth or complete missing of teeth or supernumerary teeth. Okay, hyper excitation of the enamel organ. Okay, that can result in supernumerary teeth or any other abnormalities. Okay, so you can link it with oral pathology and oral medicine, like developmental disturbances chapter also. Okay, then any change in the size and proportions that can result in proliferation. So you can see macrodontia or microdontia if any change is happening in this proliferation stage. Then histodifferentiation. Okay, the cells will undergo mostly the structural and biochemical changes. So all the special type of dentine, like the vitamin A deficiency leading to osteodentine, and all these can be seen if any kind of disturbance is happening at this histodifferentiation stage. Okay, the odontoblasts are getting differentiated and the amyloblasts are getting differentiated at this stage. So if uh, any kind of insult is happening at this stage, it can result in osteodentine and other forms of like defective type of dentine formation can be seen. Morphodifferentiation means the morphology of the teeth can be changed. Okay, so the supernumerary cusp or root and peg laterals and dilaceration, all this can be seen because of some kind of trauma or some kind of changes that is happening in this morphodifferentiation stage. Apposition is the final stage where this dental tissues and the mainly the enamel and dentine are getting calcified. Okay, they are getting mineralized at this stage. Okay, so any kind of problems at this stage will lead to amylogenesis imperfecta, dentinogenesis imperfecta, all those problems. Okay, you will study about these pathologies in detail in oral pathology, but no, you should know like which stage of the tooth is getting affected. That is leading to the formation of that particular pathology. Okay, so this is again a summary of the tooth formation, all the cells and from where the tooth germ is getting formed, the cells of the tooth germ, and which are all the products that are formed from these particular structures are all mentioned as a flow chart here. Okay, now this genetics is involved in tooth formation. It is like a very broad and very wide subject. You don't have to like study in detail regarding the genetics, but at least know the names. Okay, you should at least know the names. There is BMP or bone morphogenetic protein, and FGF8 or fibroblast growth factor, then SHH, that is the sonic hedgehog pathway, and WNT pathway, ectodysplasin A, and the homeobox genes. Okay, so these are the 6 major signaling pathways which help in the tooth development. Okay, any mutation that is happening to any of these genes can result in pathology. Okay, then the tooth position is also mainly determined by these 4 genes, which are the FGF8, fibroblast growth factor 8, PTEX2, that is the paired like homeodomain transcription factor gene. Okay. Then BMP. Okay, bone morphogenetic protein and PAX. Okay, paired box genes. Okay, all these are involved in root position. Okay, if any changes are happening to these genes, then it can result in transposition like that. Okay, the place where the lateral incisor should be, the canine can be present there. Okay, so that's called as transposition. Okay, so such pathologies can also present. Okay, now coming to amelogenesis. Amelogenesis means enamel formation. Okay, so enamel is getting formed from ameloblast. Okay, so these ameloblasts undergo lots of changes. Okay, they undergo a lots of changes in their shape, in their biochemical function, in their size, and all. They undergo lots of changes to become a different kind of cell and to secrete the enamel. Okay, so this life cycle of ameloblast or this amelogenesis is described under like around 6 stages. Okay, so what are those 6 stages? It includes morphogenic stage, organizing stage, formative stage, maturative stage, protective stage, and osmolytic stage. Okay, so there is an easy way to remember these stages of amelogenesis. That is, utilize this mnemonic. Okay, mom orders food for Mira, that is pizza from Domino's. Okay, it will be somewhat easy to remember the stages if you remember this mnemonic. Okay, so mom orders food for Mira, that is pizza from Domino's. Okay, all the first letters: morphogenic, organizing, formative, maturative, protective, and the osmolytic. Okay, this is also a very, very important question. This image is also extremely important because this image based question was asked in the recent NEET MDS 2025 exam also. So how they can ask is like all these names have been erased and they had named it like 1, 2, 3 like that, and they had asked you to identify these 2 stages. Okay, so like that also you can expect the questions. So yes, let's see what all is happening in each stage. First is the morphogenic stage. In the morphogenic stage, usually the cells will be small. Okay, just like somewhat like cuboidal or like columnar in nature. Okay, and the nucleus will be at the center, and the Golgi apparatus and all will be at the away from the basement membrane, and basal lamina and the free zone will be there. Okay, now yes. Okay, now next is organizing stage. Okay, so in organizing stage, what is happening is that like we had already mentioned the enamel and dentin formation, the odontoblasts are getting formed. Okay, so when the odontoblasts are getting formed and dentin is forming, these inner enamel epithelial cells, they are getting active. Okay, they are getting converted to ameloblast. Okay, so a normal cell will be like this, columnar, but an ameloblast will be like this, a very tall columnar, and the here the nucleus will be at the center of the cell. But look at here, the nucleus is away from the basement membrane. Okay, reversal of polarity is seen, and during the formative or secretory stage, this ameloblast will start secreting the enamel matrix. Okay, they will start secreting the enamel matrix. As you can see in this border, here the dentin is also formed and the enamel is also getting secreted. Okay, so for the enamel secretion, there are like specialized processes or specialized extension that is present, that is called as the Tom's process. Okay, so the Tom's process are nothing but they are the distal extension from the ameloblast against which this enamel deposition will happen. Okay, so this ameloblast will have like small extension areas that is called as Tom's process, and to this Tom's process only the ameloblast will be secreting enamel. Okay, then in the maturative stage is where you will be able to see such ruffled borders and smooth borders. Okay, so this is the ruffled borders. It will be something like this. Okay, so this is the ruffled border, and smooth borders will also be present. Okay. So in the maturative stage, somewhat the enamel secretion has already happened. So the cells will be somewhat shorter when compared to the formative stage, and around 50% of the cells in this maturative stage, they will undergo apoptosis. Okay, apoptosis means they will undergo cell death. Okay, normal cell death. They'll just like degrade on its own. Okay, they will undergo apoptosis and degrade on its own. But the remaining 50% or the remaining 75% of the cells, what they does is that they will remove organic material and add more of inorganic material. Okay, so if the amyloblast cells are showing this ruffled border, then that means that they are allowing the inorganic material to get inside. Okay, they are allowing the inorganic material to get inside and to deposit in this enamel structure here. Okay, so that's what ruffled border means. Now, if it is a smooth border like this, then that means that they are exiting the organic material. Okay, they are like releasing lots of organic material. Okay, so that's the difference between this ruffled border and the smooth border. Okay, and then we have the protective stage. In the protective stage, the cell will be just cuboidal shape like this. Okay, so it was tall columnar like this. Now in the protective stage, it will be just like a cuboidal stage, and it will form the reduced enamel epithelium. Okay, so first it was inner enamel epithelium, then it will get converted to amyloblast, and now it is reduced enamel epithelium. Okay, so this reduced enamel epithelium is a layer which protects the enamel till eruption. Okay, then what happens is that this reduced enamel epithelium will release lots of enzyme, and it will degrade all the connective tissue that is present in the top region, and it will allow the eruption of the tooth. Okay, so that is the desmolytic stage. Desmolysis means the enzymes that are released from this reduced enamel epithelium, it will destroy the overlying connective tissue, and it will help in the fusion of this reduced enamel epithelium with that of the oral epithelium, and will help in the eruption of the tooth. Okay, so these are the 6 stages that you see in the life cycle of amyloblast. So the amyloblasts are like continuously changing. From first it was inner enamel epithelial cells, then it become amyloblast, and then finally it is becoming reduced enamel epithelium. Okay, so you should have an idea about this 6 stage. Okay, remember the mnemonic also. Now, once the enamel is formed, okay, enamel is formed. What is the basic structure of enamel? It is the enamel rods only. Okay, they are the fundamental structural unit of enamel. Okay, so if you are looking at a tooth enamel in a longitudinal structure, okay, longitudinal structure means like this. Okay, if you're cutting the teeth like this and looking at it like this, it will appear something like this. Okay, it will be usually cylindrical in nature. Okay, so for longitudinal section, it will be like this, cylindrical in shape. Okay, but if you're cutting the tooth in a transverse section, okay, so this is the transverse section, and again you look at it under the microscope, you will see the enamel rods like this. Okay, so that is the keyhole shape, or it is also called as the fish scale shape, or it is also called as the paddle shape. Okay, paddle shape, the one we use to row the boats and all. Yes, that is the paddle shape or keyhole shape like this. Okay, so yes, it has a head and it has a tail. Okay, so this head is mainly made by the enamel rod, and this enamel rod will have a covering of rod sheath, and the tail is usually made by the inter-rod enamel material. Okay, so this is how the enamel rod will appear in the transverse section and in the longitudinal section. Okay, remember these names: keyhole shape, or fish scale shape, or paddle shape. Okay, that will be the usual shape. Okay, so these enamel rods are usually made by 4 ameloblasts. Okay, 1 ameloblast will be contributing to the head and 3 ameloblast will be contributing to the tail region. Okay, so totally 4 ameloblasts are involved in the formation of enamel rods. Okay, now take any like hard tissue deposition, whether it be bone, cementum, dentine, or enamel. This deposition will not happen at a stretch. Okay, so these cells, what they do is that they will deposit the enamel for some time and then they will take rust. Okay, then they will again deposit for some time, they will again take rust. Okay, again deposition, rusting period. Okay, so this will result in something like a rhythmic deposition. Okay, almost all the hard tissues in our body takes place in this, their development takes place in this rhythmic deposition. Okay, so this rhythmic deposition will result in formation of lines like this. Okay, so this lines of the enamel, that is called as striae of Retzius or the incremental lines of Retzius. Okay, so that's called as striae of Retzius. Okay, so in the longitudinal section, it will appear brownish dark lines like this. Now, if you're taking a transverse section like this, then it will appear something like this. Okay, concentric lines. Okay, concentric circles like this. Okay, just like when you cut the tree in a transverse section, you will be able to see concentric circles like this, right? Yes, the same kind of appearance you'll be able to see for the enamel also. Now, this striae of Retzius, sometimes what happens is that you will be able to see like wavy grooves like this in the cervical region of the teeth. Okay, mainly in the canine premolar area. If you all touch and see, you'll be able to see some small wave like grooves like things that are present in the cervical region. Okay, so these are considered as the external manifestation of the striae of Retzius. Okay, so this external manifestation of striae of Retzius is called as perikymata. Okay, it's also called as imbrication lines of Pickerel. Okay, all these terminologies are really, really important. Sometimes they can just give you a picture and ask you to identify what is it. Okay, so you should know what a perikymata is, what an imbrication line of Pickerel is. You should have an idea about that. Okay, then enamel formation for some teeth like the deciduous teeth and for the first molars, it usually happens in the intrauterine life itself. Okay, before the birth of the baby itself, this enamel formation will start happening. Okay, so the enamel formation, that is enamel formed, that is before birth and after birth, will be separated by a very prominent line. Okay, like this. Okay, it will be separated by a very prominent line like this. Okay, so that line is called as neonatal line. Okay, so that line is called as neonatal line. Okay, so neonatal line is nothing but it is an accentuated line that is separates the enamel formed before and after birth. Okay, why before and after birth the enamel formed is getting separated? Because after birth, like the baby is undergoing like lots of birth stress and there will be like nutritional changes, and maybe if the baby like encounters any disease, then there will be like metabolic changes, or because of the disease some kind of changes can happen. Okay, so all this will result in a difference in the uh, post birth. Okay, post birth enamel formation, there will be some kind of a difference. Okay, so that's why a very prominent line is seen before birth and after birth enamel. Okay, so such lines are usually seen for the deciduous teeth and for the first permanent molars. Okay, because mostly for the other teeth, the enamel formation is happening after birth only. Okay, most for the permanent teeth. Okay. Then usually the enamel rods, if you look at it, it is usually arranged in the occlusal and in the incisal third in a oblique direction. Okay, so this is the oblique direction. And in the middle third, it will be usually arranged in a horizontal direction like this. And if you look at the cervical region, it will be arranged towards an outward direction. Okay, like gingival direction. Okay, it will be usually arranged like this. Okay, but sometimes in the cusp tips of the uh, some of the teeth, what happens is that you will be able to see a wavy arrangement of enamel rods like this. Okay, so this is the wavy arrangement of enamel rods, and that is called as gnarled enamel. Okay, so this area of gnarled enamel will have high resistance. Okay, they have really high resistance against the occlusal forces and also against any kind of uh, the iatrogenic forces also. Okay, so there will be highly resistant. Okay, it will be the area that is like really difficult to cut during the cavity preparation. Okay, it is an area of increased strength, and it also minimizes the risk for enamel fracture because it is like a very strong area. It minimizes the risk for enamel fracture also. Okay, now there are something called as Hunter-Schrager bands also. These Hunter-Schrager bands are mostly like the zebra lines of enamel. Okay, so they are the alternating dark and light bands like this in the longitudinal section. So if you cut the teeth in the longitudinal section, you'll be able to see such alternating black and white lines. Okay, just like the zebra lines. Okay, so these lines, they are more prominent near the dentinoenamel junction, and towards the uh, tip portion, it was not as prominent. Okay. So earlier, the researchers thought that it was because of some kind of difference in calcification in the enamel rods and all like that. Okay. But now all those theories were discarded, and it is like confirmed that these Hunter-Schrager bands are nothing, but they are just an optical phenomenon. Okay. Just because they are viewed under us the special light under the microscope, that's why this Hunter-Schrager bands are appearing. Okay, there is no difference in the mineralization or nothing like that is there. Okay, this is just an optical phenomenon. Okay, the next is the enamel spindle. Okay, enamel spindle is nothing but it is the extension of the odontoblastic processes. Okay, so these are the odontoblastic processes, and these odontoblastic processes, they will extend across this dentino-enamel junction and will extend into the enamel like in a pointed or rounded structures with thickened head. So that is called as enamel spindle. Okay, one thing that you have to note here is that enamel spindle is not a hypomineralized structure. Okay, it's just odontoblastic processes extending into the enamel. That's it. Okay, it's not an hypomineralized structure. All right. Then, if you want to learn more about the hypomineralized structure, then the hypomineralized structures of the enamel are, first one is enamel lamellae and second one is enamel tuft. Okay, enamel lamellae, it mainly like thin leaf-like structures that extend from the surface towards the DAJ. Okay, from the surface towards the DAJ, that is enamel lamellae. Okay, but enamel tuft, if you look at it, it will extend from the DAJ to the surface. Okay, both are in opposite direction. Lamellae is from the surface to the DAJ, whereas tuft is from the DAJ to the surface. Okay, so these are like the areas of weakness where the bacteria can easily enter inside the tooth through this enamel lamellae. Enamel tuft, it will look like a tuft of grass like this. Okay, it will just look like a tuft of grass like this. They are also hypocalcified ribbon-like structures. And even after decalcifying sections also, we can see this enamel tuft. Okay, now let's look at the composition of this enamel and how this enamel is made. Okay, so the enamel is made up of 96% of inorganic material and 4% of organic material and very minimal water. Okay, so this organic material of enamel has lots of non-collagenous protein. Okay, these non-collagenous proteins are important. You should know which are the non-collagenous proteins that contribute in the enamel formation. Okay, the 90% of these non-collagenous proteins are amylogenins. Okay, and the remaining 10% are non-amylogenins. Okay, these amylogenins are the ones which provide the physical support and growth of crystals are all provided by this amylogenins. Okay, and non-amylogenins, they are the ones who promote and guide the functioning of the inorganic enamel crystals and all. Okay, so this non-amylogenins, it include enamelin, amyloblastin, tuftelin, and amylotin. Okay, so these names you should have a look at it. If any defect of this amylogenins happen, then it can result in hypoplastic enamel. Okay, it can result in hypoplastic enamel. Okay, when you study about this amyogenesis imperfecta and all, you will be dealing with this in detail. Okay, there will be gene mutations like AMLX gene mutation or ENAM gene mutation that can result in hypoplastic type of amylogenesis imperfecta, hypomaturative type of amylogenesis imperfecta. Like that, you will study in more detail. Know that in this here, this non-collagenous proteins like the amylogenins and the non-amylogenins are the ones which contribute to the enamel formation. Okay. Now, if you look at dentine, dentine also has like organic components, but more organic components than the enamel. And inorganic components like calcium hydroxyapatite crystals are also present, and water content is also more in case of dentine. Okay. So the organic components of the dentine is mainly made by type 1 collagen fibers and non-collagenous proteins. Okay, so in dentine also there are non-collagenous proteins present. Which are the non-collagenous proteins? One is DSPP or dentine silophosphoprotein. Okay, then we have glycoproteins, proteoglycans, growth factors, and other lipids and acidic proteins are also present. Okay, just like we have amylogenin in enamelin in the enamel, we have dentine phosphoproteins and other glycoproteins and proteoglycans in dentine. Okay, so that's the major difference. Now let's have a look at all the types of dentine that is present. Okay, so the first formed or the newly formed dentine that is called as predentine. Okay, so this area that you see, this is odontoblastic layer of the pulp, and these are the dentinal tubules. So this newly formed dentine that is seen just near the odontoblast layer, that is called as predentine. Okay, predentine is like not at all mineralized. Okay, it's not a mineralized area. Okay, it is least mineralized type of dentine, and it will get mineralized in future and it will form part of the normal dentine. But as the predentine is getting formed, it will be like least mineralized among all the types of dentine. Okay, it is very easy to identify this predentine using special stains, because if you stain this whole tooth, this predentine alone will stand out like this in blue color. Okay, it is very easy to identify this predentine. Okay, usually pale stained like this, or if you are using any kind of special stain, it will be like a blue color stain like this can appear. Okay, now other than that, this dentine can also be divided into three types based upon the time of formation. We have the primary dentine, secondary dentine, and tertiary dentine. Okay, primary dentine means the dentine that is formed before root completion. Okay, so this primary dentine mainly includes mantle dentine and circumpulpal dentine. Okay, then we have the secondary dentine, that is the dentine formed after root completion. And the third form, okay, third form is mainly this type of dentine, that is the tertiary dentine, is mainly the dentine formed that is in reaction to some kind of stimulant. Okay, that is because of caries or because of attrition or because of some kind of pulp exposure. Because of that, the dentine is formed in reaction to some kind of an insult or some kind of a stimulant. Okay, that is called as tertiary dentine. Okay, tertiary dentine can again be divided into two types, reactionary and reparative dentine. Okay, So what is this mantle dendin or what is the circumpulpal dendin? We will have a look at it. So mantle dendin means this yellow colored structure you see in this image, you see here. Yes, that is the mantle dendin. Okay, so it is a primary dentin that is deposited along the dentino-enamel junction. Okay, so that is called as mantle dendin. It is like very thin, only 20 microns thickness it will have. And the collagen fibers will be large diameter. Okay, they'll be large diameter. They'll be loosely packed and they are arranged perpendicular to the dentino-enamel junction. Okay, so that's how the mantle dentin will appear. Okay, so the collagen fibers that are seen in this mantle dentin is type 3 collagen fibers. Okay, what type? It is the type 3 collagen fibers and they are called as Von-Kopf fibers. Okay, remember the name? They are called as Von-Kopf fibers. And these Von-Kopf fibers are argyrophilic in nature. Okay, what do you mean by argyrophilic? They stain readily with silver. Okay, so that's why they are called as argyrophilic in nature. Okay, so which collagen fibers in the mantle dentin are argyrophilic in nature? It is the Von-Kopf fibers and they are type 3 collagen fibers. Okay, usually this mantle dentin will be less mineralized and you'll be seeing only very few defects in mantle dentin. Okay, but circumpulpal dentin is not like this. All the remaining dentin that forms the bulk of the teeth, yes, that is the circumpulpal dentin. Okay. Here, the collagen fibers have very small diameter. They are tightly packed or closely packed and they are arranged parallel to the dentino-enamel junction. Okay. Whatever that is seen in the mantle dentin, the complete opposite is seen in the circumpulpal dentin. Smaller diameter, closely packed and arranged parallel to dentino-enamel junction. Okay. And these circumpulpal dentin is also more mineralized and you can see lots of mineralization defect in case of circumpulpal dentin in the form of interglobular dentin. Okay, so that is all about the primary dentin. Primary dentin has mantle dentin and the circumpulpal dentin. Mantle dentin, the one that is seen just below the DADH, that is the mantle dentin, and the circumpulpal dentin are the other dentin that is forming the bulk of the tooth, that is the circumpulpal dentin. Now, secondary dentin. Secondary dentin is the dentin that is formed after root formation. Okay, so compared to the primary, the deposition will be somewhat slower and lots of deposition will be happening in the roof and in the floor of the pulp chamber also. The secondary dentin, when compared to the primary, they will readily sclerose. Okay, so sclerosing can be considered as a protective mechanism of dentin also to protect the any kind of microorganism or any kind of insult from reaching the pulp area. Okay, so this dentin is trying its maximum to protect the pulp area by getting sclerosed. Okay, so such kind of uh, uh, reduced permeability and all will be seen in the secondary dentin alone. Okay. Now, what is tertiary dentin? Okay, tertiary dentin in case whether because of caries or because of attrition or abrasion or during cavity preparation or because of erosion, what happens is that the dentin is undergoing lots of stresses and lots of insults. Okay, so based upon the intensity of the insult. Okay, how much intensities? Okay, some of the insults are like very intense. Okay, but some are like less intense. If it is less intense, then the odontoblast cells which forms the dentin, they will survive. Okay, but if the intensity is very high, then what happens to these odontoblasts? They will die. Okay, so if the odontoblasts are getting survive, it will result in the formation of something like reactionary or regenerated dentin. Okay, so the dentin that is formed from the survived odontoblast. Okay, that is called as reactionary or regenerated dentine. Okay, but if the dentine is getting formed, okay, the cells die. Okay, the odontoblast cells die. So a signal has been sent to the pulp. Okay, so from the cell-rich zone of the pulp, they are sending some cells. Okay, they are sending some undifferentiated cells, and these undifferentiated cells are getting differentiated and again getting converted to odontoblast. Okay, so they will again start forming dentine. Okay, so the dentine that is formed in that case is called as the reparative dentine. Okay, a repair has been done. Okay, the odontoblasts are dead, so they are getting replaced by cells from the pulp, and a repair of the and a new form of dentine is getting deposited, which is called as the reparative dentine. Okay, so this is the major difference between this reparative dentine and reactionary dentine or regenerative dentine. Know the difference, understand the difference. If the intensity is very high, these odontoblasts die. So these odontoblasts will be replaced by odontoblasts or the undifferentiated cells from the cell-rich zone of the pulp. And these these cells from the cell-rich zone, they get differentiated and form new odontoblasts, and they will form reparative dentine. Okay, but in the case of reactionary dentine, what is happening is that because of the insult, the cells are not getting dead. Okay, they can survive. Okay, these cells, odontoblasts, are strong enough to survive. Okay, so when they survive, um, but still they are damaged. Okay, so what happens is that the dentine that they are getting, that they are forming is some kind of irregular. Okay, the newer dentine that is formed in the form of this reactionary or regenerated dentine will be irregular appearance, and it will also have very few dentinal tubules. Okay, such kind of changes will be seen in this type of tertiary dentine. Okay, so this is how the reparative dentine will look like. Okay, so this is how a normal dentine looks like. Okay, the tubules will be like closely arranged and it will be properly arranged. Okay, but in case of like a reactionary dentine or in case of like reparative dentine, it will be somewhat like this. There will be only few tubules present. Okay, then in reparative dentine also, what can happen is that usually an odontoblast, when it releases dentine, okay, when it helps in dentine formation, it will secrete the dentine matrix, then it will move back. Okay, it will move back. It will secrete the dentine matrix. These cells will move back. Okay, odontoblast, when they secrete the dentine matrix, it will secrete and then it will move back. It will again secrete, then it will again move back. It will again secrete, then it will again move back. Okay, when it moves back only, it will be able to secrete again. Okay, it will not get entrapped in that hard tissue. Okay, but sometimes what happens in case of this reparative dentine, this odontoblast, they will not move back. Okay, so what happens is that they will get entrapped in the hard tissue. Okay, just like the bone. Okay, in the bone, if you look at it, you will be able to see small cells inside the bone. Yes, that are called as osteocytes. Okay, in dentine and enamel, you will not be seeing such things. Okay, usually the cells will move back and allow the matrix to get mineralized. But sometimes in defective cases, like in this reparative dentine, what happens is that these cells will not move back and they will get entrapped in the hard tissue. Okay, so it will resemble something like a bone. Okay, so since it resembles like a bone, it is called as osteodentine. Okay, just like bone. Okay, that's why it's called as osteodentine. Okay, and sometimes like irregular haphazard arrangement like this will also be seen for tertiary dentine, or like a combination of all these four structures can also be seen for tertiary dentine. Okay, so know the difference between this reparative dentine and reactionary or regenerative dentine. Okay, next is dead tract. Okay, again, if in case of an insult like caries or attrition or abrasion or cavity preparation, there will be degeneration of the odontoblast processes. Okay, odontoblast processes, they will get degenerated. So the reparative dentin, what it does is that as a protective mechanism, it will just seal the dentinal tubules at the pulpal end. Okay, so at the pulpal end, this reparative dentin, it will seal here. Okay, so the remaining area of this dentinal tubules, it's empty and it gets filled with air. Okay, it gets filled with fluid or gas or some kind of air. Okay, so that teeth, if you do a ground section and you look at it under the microscope, it will appear black like this. Okay, the same structure, if you are looking at it under a reflected light, it will appear white like this. Okay, so these are called as dead tracks. Okay, they are nothing but they are the degenerated odontoblastic processes, and it is considered as the initial step in the formation of sclerosis of dentin. The usually this kind of dead tracks are usually seen in like older teeth. Okay, because of attrition and all. Usually older teeth, if you do ground section of older teeth, you'll be able to see dead tracks like this. These teeth will have decreased sensitivity also. Okay. Then there is something called as, okay, these are the dentinal tubules. Okay, these small round-like areas you see, they are the dentinal tubules. Okay, so these dentinal tubules will be surrounded by a very highly calcified matrix. Okay, so all these dentinal tubules will be surrounded by a highly calcified matrix. That matrix is called as the peritubular dentin. Okay, so this is one peritubular dentin. This is another peritubular dentin. This is another peritubular dentin. Like lots of peritubular dentin is there surrounding every dentinal tubules. Now, in between this peritubular dentin, the dentin that is present in these areas here, yes, that is the intertubular dentin. Okay, they are present in between the tubules. That is why it's called as intertubular dentin. Now, like I had already mentioned, for the circumpulpal dentin, defects can happen during mineralization that will result in such globule-shaped areas that is called as interglobular dentin. Okay, in this interglobular dentin, usually this peritubular dentin will be absent in these areas. Okay, so you should remember that. Okay, so this is regarding all the types of dentin. Okay, all the terminologies of dentin I had like explained in brief. Please don't get confused between different types of dentin. Okay, then the incremental lines of dentin. The incremental lines of dentin are called as the von Ebner lines. Okay, the incremental lines of dentin is called as von Ebner lines. And just like the neonatal line in the enamel, there is a neonatal line in the dentin also. And there is another like very prominent line that is present in dentin that is called as the contour line of Owen. Okay, so this contour line of Owen is nothing but it is a very prominent or accentuated incremental line that is present due to some kind of stress. Okay, it can be birth stress or it can be metabolic stress or it can be some other because of some other body changes because of the stress. There will be like prominently seen. The line will be prominently seen in the dentin. Okay, why it is prominently seen? Because the dentin that is deposited before that event and after the event is different. Okay, so that's why such a prominent line is seen. Okay. Now let's have a look at the questions. The first question, the buccopharyngeal membrane is formed by. Yes, doctors, answers please. How is the buccopharyngeal membrane getting formed? Is it by ectoderm alone or mesoderm and endoderm or ectoderm, oral ectoderm and foregut and endoderm and or oral endoderm and foregut ectoderm? Okay, what makes the buccopharyngeal membrane? This is a recent NEET MDS 2025 question. Yes, anyone know the answer? How is the mucopharyngeal membrane getting formed? Ectoderm. Okay. Okay. Yes. So the buccopharyngeal membrane, which is going to break, okay, that is formed with the help of oral ectoderm and foregut endoderm. Okay, only two layers will be present in the buccopharyngeal membrane. That is oral ectoderm and foregut endoderm. Okay, oral ectoderm, the lining of the stomatodium, the lining of the primary oral cavity. Yes, that is the one contributing structure to buccopharyngeal membrane, and the underlying structure is the endoderm. Okay, the future foregut. Okay, so the endoderm of the foregut is contributing to the formation of buccopharyngeal membrane. Yes. So yes, it is option C, oral ectoderm and foregut endoderm. Okay, that is the correct answer. Now, next question. Identify the structure marked in red in the given image from the cap stage of tooth development. Yes, doctors, answers please. We had already studied about this. This structure that is marked in red, what is it? It is a transient structure that is present in the cap stage of tooth development. So what is this? This is also a recent NEET MDS 2025 question. Yes. All are right. It is enamel note. Yes. Now, it's right. Option D, enamel node is the right answer. Yes, all are right. Now, the following image shows stages of amelogenesis. Identify stages 5 and 6. Okay, 5 and 6 from the given image. Is it morphogenic or maturative or organizing or protective? Okay, the same image. Again, this is a NEET MDS 2025 question. Yes, look at it. The main clue is this ruffled borders. Okay, look at the ruffled borders in the basal end of the ameloblast. Yes, all are right. It is a maturative stage. Okay, another NEET MDS 2025 questions, extremely important. Okay, it shows maturative stage. Okay, as you can see here, it shows the maturative stage. The next, which part of the enamel shows maximum resistance to forces applied during cavity preparation? Okay, which part of enamel is the most resistive? Yes, doctor. Is it cervical enamel or proximal enamel or gnarled enamel or prismless enamel? Yes. Yes, doctors, answers please. We had already discussed the most hardest part of the enamel, which is that. Yes. All are right. It is option C, gnarled enamel. Okay, gnarled enamel. We had already discussed wavy arrangement, area of increased strength. It is gnarled enamel. Okay, minimal risk also for enamel fracture. Okay, so this part of the enamel shows maximum resistance to cavity preparation. The next, deficiency of amelogenin will result in. Okay, another NEET MDS 2025 question. So what does the deficiency of amelogenin will result in? What type of enamel? Yes. Yes. It will result in, yes, all are right. Yes. It will result in hypoplastic enamel matrix. Okay. The enamel formation itself is not happening. The enamel matrix formation itself is very defective in case of the amelogenin deficiency. So yes, it will result in hypoplastic enamel. Now, the next question. The organic phase of dentine is primarily composed of which type of collagen fibers? Yes, doctor's answers, please. Yes. Is it type 1 or type 5 or type 3 or type 9? Yes. Again, the organic phase of dentine is primarily composed of type 1 collagen. Okay, it's the type 1 collagen. Okay, type 3 is present in the which type of dentine? Type 3 is present in the mantle dentine. Okay, type 3 collagen fibers, Warnkoff fibers, they are present in the mantle dentin. Okay, the organic phase is mainly composed of type 1 collagen. Okay, remember this flow chart. Organic component, mainly type 1 collagen fibers. Okay, next. The first sign of dentin formation is the appearance of which structure? The first sign of dentin formation. Which structure? Tom's processes? Yes, doctors, answers please. What is the first sign of dentin formation? Yes. Lines of von Ebner is the incremental line. Okay, that is the incremental line of dentin. So not that. Tom's processes, no, it is present in the enamel against which the enamel formation happens. So not that. Contour lines of Owen, that is the accentuated type of like the incremental line that is present in dentin. Okay, because of some kind of stress. Yes. So the answer is option C, von Kopf fibers. Okay, von Kopf fibers is the correct answer. All right. Yes. Moving on to the next question. Yes. This is the von Kopf fibers. Yes. Next question. Unmineralized zone of dentin seen above odontoblastic zone is called as what? Not the word unmineralized zone of dentin. Okay, above the odontoblast layer, what is it called? Unmineralized zone of dentin? Yes. Yes. Yes, doctors, all are right. It is this unmineralized and first formed or the newly laid dentin that is above the odontoblast layer that is called as the predentin. Okay. I told you this is the odontoblast layer and look at the color difference itself. Okay, here it is highly mineralized dentin. Okay, so it will appear pinkish, but here it is just appearing like very lightish pink. Okay, so that's the major clue. Okay, so this is the unmineralized zone of dentin. Now, identify the type of dentin that is shown in this following image. What is it? Is it a normal dentin or a reparative type of dentin or osteodentin or none of the above? What is this type of dentin that is seen here? Note the point. The cells are getting entrapped in the matrix. Okay, so what is it called? Yes. The cells are getting entrapped in the matrix. So it will look just like a bone. Okay, so the dentin that looks like a bone, what is that called? It is called as option C, osteodentin. Okay, it is called as osteodentin. So this is a typical image of osteodentin. Okay, now the transverse wave-like grooves that are marked as A in the given image. Okay, so if you look closely, you'll be able to see like the transverse wave-like grooves like this. Okay, what are these called? Are they called perikymata or enamel lamellae or contour lines of Owen or lines of Salter? What are they called? They are called as perikymata. Yes, doctors, you are right. They are called as perikymata. Perikymata is also called as imbrication lines of pickerel. They are considered as the external manifestation of striae of Retzius. Okay? Yes. Option A is the right answer. Now, next question. The earliest histological indication of tooth development is present at which week of embryogenesis? Is it 6th week or 2nd week or 4th week or 3rd week? Okay. That is when the oral ectodermal cells, they starts proliferating and forms like a proliferation in the ectomesenchyme. At which week? Yes. Yes, most of you are right, doctors. The earliest histological indication of tooth development, they usually happen around 6th week. Okay, that's when the basal cells of the oral ectoderm, they start proliferating and will like go inside the ectomesenchyme. Okay, so that will usually happen by around 6th week of embryogenesis. All right. Yes. Next. Which of the following structure here that is present in the image represent vestibular lamina? Okay, remember, dental lamina is usually seen at the inner or lingual region, whereas vestibular lamina will be usually seen at the labial or the buccal region. Okay, so which of the following structure here represent the vestibular lamina? Yes, is it A, B, or C, or D? C. Yes, you are right, doctors. Usually, like I had mentioned, the dental lamina will be usually seen in the inner or lingual region, and the vestibular lamina will be usually seen in the buccal or labial region like this. Okay. Now, the cells in this vestibular region, some particular cells, it will undergo degradation and will form the future vestibule of the oral cavity like this. Okay, so that will lead to hollowing, and it will result in a sulcus-like depression, and it will form the future vestibular lamina. Okay, so this vestibular lamina, it is also called as lip furrow band. Okay, it is also called as lip furrow band. Now, next question. A dental researcher was conducting studies on root development of teeth. Okay. He was mainly focusing his studies on Hertwig's epithelial root sheath. Which cellular components constitute Hertwig's epithelial root sheath, taking into consideration their origin? Okay. So, will this Hertwig's epithelial root sheath contain outer enamel epithelium and stratum intermedium, or inner enamel epithelium and stratum reticulum, or outer enamel epithelium and inner enamel epithelium only, or stratum intermedium and stratum reticulum? Okay. So, which cells form the Hertwig's epithelial root sheath, or the HERS? Yes. Yes, doctors. Yes, most of you are right only. Hertwig's epithelial root sheath is mainly formed by outer enamel epithelium and inner enamel epithelium only. Okay. So when the hard tissue formation, that is the enamel and dentin formation, when it reaches the cervical loop, okay, that is the future cemento-enamel junction or the cervical loop region, what happens is that this Hertwig's epithelial root sheath will start getting formed. Okay, so this Hertwig's epithelial root sheath will only have two layers. Okay, it will just have the outer enamel epithelium and the inner enamel epithelium. Okay, no stellate reticulum, no stratum intermedium will be seen. Okay, so that's the specialty of Hertwig's epithelial root sheath. Okay. Now next, the line separating the prenatal enamel from the postnatal enamel in the image given below. What is that line called? Very easy. Prenatal enamel and postnatal enamel. What is that line called? Yes. Contour lines of Owen that is seen in the dentine. Incremental lines of Salter that are cementum incremental lines of von Ebner that are the incremental lines of dentine. Okay, so what is remaining? Yes, option A, it is the neonatal line. Okay, so when you don't know an answer, okay, when you are not able to pick an answer directly, then you can do this elimination technique. Okay, so what is this elimination technique? Look at all the options and rule out one by one. Okay, lines of Owen, it is seen in dentine, not in enamel. Salter, seen in cementum, not in enamel. Von Ebner, again, dentine lines, not in enamel. Okay, so what is the option that is remaining? That is neonatal line. Okay, mostly that will be the correct answer. Okay, so try practicing this elimination technique in all your mock tests also and see whether it is working for you guys. Okay. Yes, any doubts? If you have any doubts, you can ask me now. Okay, I think like most of you don't had dinner and are hungry. Okay, so Yes, if you don't remember the doubts now, then you can ask me in the group also. Okay, I will definitely answer all your queries in the group, in the WhatsApp group, or you can comment below this video also. We'll definitely answer all your queries. If you're having any doubts, you can directly DM me or you can ask in the doubts, no issues, or you can ask in the WhatsApp group. Okay, no issues. Feel free to ask doubts and keep learning, keep revising, and keep practicing MCQs. Whatever you have learned, make sure that you revise the same topic the next day also. Okay, so that it will stay in your mind and you will not forget it. Okay, so otherwise, this week you are studying one topic and after 4 weeks you are looking at these topics, you will not remember anything. Okay, so keep revising along with learning. Okay, so that's extremely important. So yes, all the best for your preparations. Do well and I will see you for another live class. Goodbye and good night.